Thank you everyone for joining us today, and namaste. And thank you, Dr. Videsh Shanbag. Our second discussion is going to be on, there are going to be 6 speakers, and it's going to be on how boost your immunity and how does Ayurveda and Siddha fortify immunity. Where do we find these treatments in North America? So our first presenter is going to be Dr. Shekhar Anand. He's a registered Ayurvedic doctor, master Ayurvedic specialist, licensed in integrative body work massage. He's a yoga teacher, and he has 33 years of experience in teaching, counseling, and research in the field of Ayurvedic medicine. He's the president of AAAP, and he's a certified pranic and Reiki healer. Dr. Shekhar is going to talk about Panchakarma.
Thank you very much, all of you. I'm excited and listening to this wonderful information to all the presenters and directors, and I've given 8 minutes time. And Panchakarma therapy for immunity, my master's degree, post-graduation, MD in Ayurveda, Panchakarma therapies and Kaya Chikitsa. So this is my wellness center, my practice here. And let me show you full screen. Yeah. So what is Panchakarma? Panchakarma means 5 types of therapies or Panchakarma. It's well known. Pancha means Sanskrit word and karma means actions. Along with that, people may think about only 5 days we can spend the Panchakarma therapies, then it's done. Not like that. It is a lengthy process. Pre-operative, operative, post-operative. 3 steps are taken to the position, and we are going to show you in the clinical studies what we have done. More than 1,400 clients who has received Panchakarma therapies. Today, 70% of death due to the chronic diseases rather than the infectious diseases. So we can handle the chronic conditions very well, and allopathic system of medicine, conventional medicine can handle very well with the more infectious diseases, antibiotics and various things. So regarding the immunity, Panchakarma definitely a very good boon for improving the overall health. Acharya Charaka has mentioned, dosha kadachit kupyati jita langhana pachanai jita samshodhanardena tesham punurdhavaha. Means the diseases can be ruled out by if you are cutting the only weeds you are cutting on the top of the thing, it will come out again and again, and they are also becoming stronger and stronger. So our goal is that to remove the disease from the root cause of the disease. Panchakarma is necessary. A lot of people may think about that, okay, they have a headache or some migraine headache, certain problems are there. Then they may take some supplements that definitely helps them a lot, but the root cause is not completely ruled out. We have to go through the Panchakarma process. So Panchakarma is Shamana, Shodhana therapies and purification therapies, and also finally we do the rejuvenation therapy, Rasayana therapy and Vajikarana therapy also we provided. So Shamana and Shodhana therapies we are going to do, removing the Shamana Chikitsa, where we do a lot of Amapachana, the detoxification of the body, and along with that we do the main Panchakarma therapies. I'm going to talk about that. The main purpose of the Panchakarma therapies is the health maintenance, elimination of the disease, prepare for the rejuvenation. These are 3 steps are done in the Panchakarma therapies. So swasthasya swastharakshanam, atarasya vikara prashanam, that is the goal of Ayurveda. To maintain preventive care is the Ayurvedic perspective of the healing the Ayurveda. So we do also seasonal cleansing programs, that is called Ritu Panchakarma, according to seasons. So particularly we have in North America, we have 3 seasons are there: autumn, summer and spring. These are the different seasons. We perform various Panchakarma therapies according to the individual client's evaluation. And removing the disease as a whole, and rejuvenation therapy. Finally, we provide the rejuvenation, revitalization therapy. We give the protocol after Panchakarma, what they have to follow, how they have to follow, what the steps they have to do, what the follow-up has to do, what the doctors they have to meet, and how the follow-up can be done. Systematically, we'll explain to them. And benefits, there are thousands of benefits are there. There is the scientific studies are done, various things. First of all, it relieves the stress in the body and also slows aging process and detoxifies the body. And goes to the digestion, metabolism, enhances the metabolism. We have studied on everything step by step according to the Ayurvedic principles, not on the basis of the Western way like that. We have a Western investigations can be done, but we have seen the very good positive subjective changes are happening in the patients, not objective changes much. So, and also we have seen there is a reduction in the cholesterol levels, decrease in the lipid peroxide levels, increase in the HDL levels. These are the blood pressure reduction, various conditions has seen. And there are some contraindications are there. Of course, Dr. Sujata was saying that, yes, there are side effects are there. People may undergo some side effects are there. We have seen this one, but people are unnoticeable that pregnancy is not allowed. Lactation, extreme obesity, morbid obesity conditions, for example, 600 pounds. A person is suffering with 600 pounds. They cannot go for Panchakarma. 400 pounds, not allowed. 500 pounds, not allowed. So there are indications are there. Ayurveda is not for Panchakarma, is not for every patient. Only selected patients. Cancer of the lungs, melanoma, hypertension, angina, CCF, emaciation, active infectious conditions like HIV, AIDS, or any active infections. So these are the conditions contraindicated. There are n number of cases are there. We have to look into the individual cases on the basis of that. The practitioner, highly well-trained, qualified practitioner has to do it. Not like a 500 hours of massage therapist can do it, this type of therapist. So what happens here, that all the toxins are eliminated from the body, various parts of the body, complex body in the body. And we are also having various detoxification methods. Ama is residual in the various parts of the body. It can be removed. And in the liver, complex organ, major organ, and also intestines and all the pancreas and gallbladder and spleen and various organs in the body, it can be eliminated. And the reflex, there are several reflex points are there. Majority of the diseases are connected to the colon, and a lot of cleansing can be done through the colon, and 80% of the diseases are originated from the colon, and that is all vata disorders. So urinary tract system, it has to be cleared up, everything, and upper respiratory tract infections like that, all the infections can be taken out. So now I am going to show you some of the therapies. So we do also Panchakarma therapies for Shirodhara therapy. Shirodhara by various therapies are performed in this procedures. Netra Tarpana therapies are performed also. And here is the list of the numerous number of immunological disorders are there, which they have no answer for that, Western medicine. But Ayurveda can marry together with the Western system of medicine. They can work together. Really, it will give us a wonderful, remarkable help for the human mankind. So these are the clinical studies we have done through. So 33 years of my practice, I have collected the data of the 1400 patients. So these are the patients, age group between 40 to 50 years of age group of people, 34% of people who are participating in this program. And this is the statistical data I have shown that. And gender, more females, 987 patients clients are from the Panchakarma undergone. And they have Prakriti. So this is the very unique way of looking for the Ayurveda, is unique into that. First of all, we look into the person as a Prakriti. And individual Prakriti, constitution is important. We have divided into this all the things of Vata, Pitta, Kapha, Vata, Pitta, Vata, Kapha, Pitta, Kapha, Pitta, Vata, Kapha, Vata, Kapha, Pitta, and Tridosha. This is the combination of, if you look into that, out of 1400 patients, clients, we have subjects we call, and 345 clients and subjects are having a highest Pitta Vata patients in our group, small group.
Dr. Bova, you have 10 seconds.
Next, Manasa Prakriti, psychological constitution. Also, we look at this is the very unique formula of these things. So, a lot of people think about that Prakriti means only physical constitution. Mental constitution is important also. Sattva, Rajas, Tamas, Gunas. Also, they are taken to this thing. And Rajas is the highest number of patients who are having 738 patients. We have noticed this one. And this is the study has shown. And there are subdoshas of each and every subdosha has divided into the 5 subdoshas: Prana, Udana, Samana, Apana, Vyana, and Pachaka, Ranjaka, Sadhaka, Alochaka, Bhrajaka, Kledaka, Avalambaka, Burodaka, Tarpaka, Sleshaka. These are the 15 types of subdivisions are there. We look into that each and every symptom having various symptoms are there. There are locations are there. For example, Pranavata is located in the head. So there are symptoms are associated with that.
Shekhar, we have to wrap it up.
Okay. So this is Dana. Sadhaka Pitta is explains about these things mainly. And Dhatus, various Dhatus are also explained. And Rasa Dhatu. And Vishama Agni and irregular digestion has shown up. And Crore Costa, and mainly the digestive system is upset for the patients, a lot of patients. And vegan and vegetarian diet we have taken into consideration also. And then we have gone through the various theories, therapies also done. These are the almost 21 therapies we perform in our center and Panchakarma therapies. Along with that, how the improvement in the subjective way, how the changes are happening in our physiology, that also has shown. And this all the data is available and it is posted on our website. And this is the Panchakarma dates. So 5 to 21 days we do Panchakarma therapies, and then 1400 patients who are gone through this process. And this is the improvement level, total improvement level. If you look at overall improvement is there, 25% of the people completely improvement is the marked improvement is there. Thank you very much.
Thank you, Dr. Anbodla. Thank you for that insightful talk.